Hey, everybody, this is Greg Lake with the EntheoConnect.com podcast, here to bring you an episode today on a substance we have not touched quite yet, which is ketamine. We're here today to talk with Charles Patti, who is a very good and dear friend of mine who works and operates a clinic, a ketamine clinic out of Naples, Florida. Charles, how you doing today?
Doing fantastic. Thanks for having me today, Greg.
Yeah, very, very honored to have you. And as I told you before, Charles, we'll kind of cover kind of the scientific, what I would say, portion of this on the front end. On the second half, I want to obviously talk about your story, my story, and kind of the spiritual dimensions of ketamine therapy. But we'll kind of start off, a discussion of what is ketamine. We'll talk about, ketamine for depression, ketamine for anxiety, ketamine for addiction. And then I'd also like to touch on kind of what's the difference between a ketamine infusion and then kind of like your clinic that does the intramuscular ketamine injections as treatments, and just kind of touch base there. So let's backtrack a little bit. What is ketamine?
So ketamine is a dissociative anesthetic, and it's not classified as a psychedelic compound. That being said, it is giving people incredibly profound psychedelic healing experiences. Ketamine is one of the safest, least toxic anesthetics on the market. It is so safe that they actually use it on toddlers, children 1.5 and older, for surgeries. I'm sure some people out there have heard that, isn't that a horse tranquilizer, and or don't they use that on cats? And yes, ketamine is actually so safe that they do use it on animals as well.
Yeah. And to me, horses are so sacred, and I can't help but think that's something that, is used on a sacred animal. I don't have any objection to using it as well.
No, yeah. And, listen, ketamine has been FDA approved since 1970 as an anesthetic.
Yeah.
And it's actually on the World Health Organization's top 10 essential drugs because of its safety profile and efficacy.
Yeah. And I remember, and we'll talk about my treatment at the end, but in doing my research, I learned that ketamine is one of the most profound medicines out there, just in its wide application, efficacy, and safety.
100%. And honestly, like, they're using it for so many different things right now when it comes to depression, anxiety, post-traumatic stress disorder, substance abuse issues, OCD, bipolar disorder, pain management. We're going in and we're resetting the receptors in the brain that actually make people experience pain. So we're helping people get off of their opioid medications. This medicine is so versatile and has so many uses, and it seems like every day there's new studies coming out where it works for something else. We actually just had amazing results with helping people with Parkinson's with it as well.
Wow, incredible. And so let's just and we'll touch on this first. The difference between, because I know a lot of people who are new probably wonder this, what's the difference between like a ketamine infusion and then kind of like what y'all do, the ketamine intramuscular injection, and then I guess we'll throw a third in here, these ketamine troches, I think is the way to pronounce it, that they're coming out with.
Yeah, no. So your typical facility is going to be doing IV ketamine therapy. This is when you do for most of the part, people are going to be doing 0.5 milligrams per kilogram over a 45-minute drip. This is definitely helping people with depression and anxiety and things to that effect. We do things a little differently at our facility. We do offer IV therapy. We prefer and mostly do intramuscular shots of the medicine at our facility. We don't have a 0.5 milligram per kilogram dosing protocol either, because we really specialize in psychedelic ketamine therapy. And this is when people are having profound healing experiences or going into a dreamlike state where people sometimes are having divine experiences and say that they meet God. Sometimes people are going down into oneness with everything and being, whole with consciousness and realizing that we're all connected. Sometimes people will say they speak with deceased relatives during their treatments. Sometimes people go out into the cosmos and meditate. And then other times people will actually go back to a past traumatic experience that they've been through, watch it play out from a third party perspective where there's no real feeling or emotions attached to it, so they can process it, release it, and let it go. And so to answer your question, I personally feel that the biggest difference between IV and IM is getting people into these therapeutic
Okay.
dreamlike states. There's something very magical about all of the medicine hitting the system within around 10 minutes from an intramuscular shot rather than dripping it over a 45-minute period through an IV.
Mm-hmm.
And then, so with the troches or troches, sometimes people call them, these are oral sublingual doses of ketamine. Um, I We did offer that at first when we opened the clinic. What we found was that more people were getting nauseous off of the
Okay.
medication when they took it orally, so we
Mm-hmm.
took that out of the protocol. Um, these are the actual like at-home ketamine treatments that you'll be hearing about coming out,
Mm-hmm.
which I'm personally not a huge fan of. I really feel that, when you're when you're taking any kind of sacred medicine and going into it for a therapeutic purpose,
Mm-hmm.
or even for spiritual growth and cosmic expansion, or whatever label you want to put
Mm-hmm.
on it, I really feel that it's important to have somebody present with you that can help you and integrate something that you might have gone through after your experience. There's a real energetic connection between people. So just trying to say, here, the medicine's it, and this is the medicine, and the medicine does all the job, I think is putting a little bit too much emphasis on the medicine,
Mm-hmm.
just because there's so much more intricate parts of the healing process that actually take place.
And so, me and you both agree that it's kind of, a lot of it's the spiritual experience and the process that you're able to go through during that, again, with the detachment from all these situations and trauma. Some people are so, and this leads to depression, right? You are so enthralled in your trauma that you've never had a relief, that you've never been able to, even for a second, step back and take a look at it, right? Because you're living and you're existing in it all the time. And that, these ketamine treatments for at least 45 minutes, which feel a lot longer, give you that window to actually step back from all this and take like a third party observer look at it, and able to process it without getting stuck in all these very confusing and very powerful emotions.
No, I completely agree. And, I actually think that ketamine is incredibly important when it comes to this kind of work, when we're just talking about healing and psychedelic compounds and things to that effect, because there's something very different about ketamine because it's a dissociative. And so I've had tons of spiritual experiences on other psychedelic compounds. I've
Mhm,
had, incredible experiences that propelled me forward in my own healing journey and
mhm,
assisted me in life a lot. But ketamine, when you get into a disassociated state, it tends to help remove the blocks that are holding past repressed
mhm,
traumatic
mhm,
experiences. So the thing is that, when we go through life, we have a tendency to stuff things, repress things. Sometimes we don't even know we're repressing them, or
mhm,
sticking things into our subconscious. And when you get into these disassociated states on ketamine, where it separates the mind from the body, it takes
mhm,
the blocks down that are holding
mhm,
these past repressed experiences, and it really allows people to process, release, and let them go. So,
mhm,
like, before I say this, I'm not saying any compounds are better than any others,
mhm,
but I will
mhm,
say that we've had people that have sat in numerous other kind of plant medicine ceremonies before coming and doing their ketamine treatments, and ultimately they felt like not that those experiences didn't do a ton of healing on them, which I know that they did, but there was something that the ketamine brought to the table that they hadn't gotten another experience, just because of the actual dissociative factor.
mhm,
And I got it, like, since we're going to go ahead and talk about it, I believe that everything is energy, and that energy
mhm,
is always vibrating at a certain frequency. And when you consume medicines, no matter, how you administer or take them, you do take on the vibration of the compound or the crystal or the medicine that you are taking. And I believe ketamine to be one of the highest vibrational crystals on the
mhm,
planet. So when we're talking about, shedding, we have a lot of shedding at our facility, where people will shed off lower vibrational things that can't hold on and attach to them anymore, because of the ketamine raises their vibration to, which I
mhm,
believe, one of the highest frequencies possible.
mhm. So this thought of ketamine, curing or helping depression, which there's a lot of very solid scientific evidence of this now, legitimate, studies. Where
Yeah.
did this all come from? Do you know, like, where it originated, that people were like, this ketamine seems to be working, not just as like an anesthetic or, helping people through a surgery, but also is having an effect on their depression. Do you have any clue how that kind of came about to where they started to look into this?
Well, I know that they used ketamine in the Vietnam War. It was called the buddy drug. And it was
Mhm.
basically like the efficacy and safety profile was
Mhm.
so amazing that you could administer the medicine to like one of your buddies who had got injured during
Mhm.
war. And so I think that, they probably noticed something then, but I also believe that, ketamine is used in surgeries. It's used in
Mhm.
the OR.
Mhm.
And for a long time, ketamine was actually being used on adults a lot also,
Mhm.
and not just children. But the thing is that people were having these profound experiences when they
Mhm.
were going into surgeries where people,
Mhm.
said they met God, or,
Mhm.
they had
Yeah.
this divine experience and they thought they died. And then so it kind of like threw them for a loop. And the doctors were having a hard time explaining this kind of stuff to people. So they really moved it to just specifically working with children more or less nowadays, because a child can have a magical experience and,
Mhm.
and it won't really throw the child for a loop. That being
Mhm.
said, people were going into surgeries that had been suffering from depression, anxiety, PTSD, and a string of other things. And then
Mhm.
people were coming out of the surgery and they had this relief that they hadn't felt in years. And so they started researching this stuff. They started doing clinical studies with it. They started noticing that ketamine is actually going in and physiologically remapping and restructuring the neural pathways in the brain. So whenever we've had any kind of traumatic experience in our life, or even just through the course of life, our neural pathways get damaged. And when the neurons are trying to flow through the pathway, they actually start to bounce off the walls, which can cause depression, anxiety, PTSD, and a string of other things. The ketamine is going in and physiologically remapping and restructuring the neural pathways, but actually sprouting something called new dendrites, which is causing new neuroplasticity or new neural connections in the brain. And it's
Mhm.
also going in, and there's scientific studies that are showing that it's helping turn on the receptor in the brain that creates our dopamine, which is our feel good chemical,
Mhm.
which is what motivates us to get out of bed in the morning, and
Mhm.
go and, try to live our dreams. So in conjunction with the physiological healing that's happening, the increased production of dopamine, and then these incredibly profound healing experiences, in
Mhm.
my eyes, I think that ketamine is probably one of the most valuable tools that we have right
Yeah.
now for mental health.
And so when we talk about like depression, anxiety, addiction, a lot of times those three are pretty much one and the same, meaning that one person can usually manifest all three of those coming in. But I mean, I guess let's kind of zero in on the addiction. Have you seen amazing results with people with addictions coming through as far as working with the ketamine or doing the treatments?
So ketamine for addiction is amazing. I
Mhm.
honestly think it's one of the most valuable tools like
Mhm.
for mental health that we have. And
Mhm.
the thing is that, you know, ketamine's helping get to the root issue and the root cause of why people are self-medicating with drugs and alcohol to begin with. So the truth is that, whatever my symptoms are, whether it's, depression, anxiety, PTSD, all of this stuff, which people tend to
Mhm.
self-medicate with drugs and
Mhm.
alcohol, if we get to the root issue and the root cause, then we don't really
Mhm.
need to medicate with drugs and
Mhm.
alcohol anymore. They actually just did a clinical study from a company called Awaken Sciences in Canada.
Mhm.
And basically they administered ketamine to a group of people that had AUD, or alcohol use disorder.
Mhm.
And typically, if people will go to a detox, a 28-day stay in rehab, 12-step meetings for the rest of their life, there's around a 3 to 5% chance of long-term sobriety with those
Mhm.
people.
Yep.
With the clinical study, what they did with AUD with ketamine, after 6 months, 86% of the participants hadn't had one sip of
Wow.
alcohol.
Wow.
And what people also don't realize for a lot of the time is that Bill Wilson, who was actually the co-founder of Alcoholics Anonymous, he founded the program with a guy named Dr. Bob. Well, Bill Wilson actually had a profound psychedelic experience in detox off of belladonna extract, where he saw visions of the future and a society of alcoholics helping each other stay sober. And 20 years into Bill's own recovery, he actually used LSD to heal his own depression. So in my eyes, I don't think that there's any more beneficial way to treat these kind of issues other than psychedelic or ketamine therapy out, because like I said, we're getting to the root issues.
Yeah. Okay. So let's talk. So obviously there's propped up in the US and abroad different clinical models. Like you said earlier, some do like the IV, some do the intramuscular, and then there's also different setups. Some have private patient rooms, some have group rooms where they have multiple people in the same room doing a therapy. And, I've obviously had a personal experience at yours, which I think is a great model. But do you want to kind of compare and contrast some of these varying? And one more thing, I think now they're moving for like, in for better or worse, a telehealth type model where people actually like sit at home like us over Zoom right now with a doctor while they consume the ketamine. Do you want to briefly touch on these different models and kind of what your thoughts are on each one?
For sure. So I guess, your first model would probably be like a doctor's office. Your more clinical model, where this is, very Western, and it's just, white office, nurse comes in, administers the medicine, and you just kind of, get your experience, and it's very, very clinical feeling. That is much different than what we offer at our facility. We kind of built our company on what not to do's, and I felt like, if I was going to go have a profound psychedelic experience, I probably wouldn't want to do it in a doctor's office. So we have more of like your med spa kind of feel, where you're a perfect blend of East meets West, or where science meets spirituality, where everybody gets their own personal rooms. It's got really nice, comfortable recliner style chairs. There's diffusers, meditation music playing. I really do preach that this is a tool for meditation. I joke with our clients and say, you can achieve what a Buddhist monk that's been meditating for 50 years can achieve in an hour at our facility. We have a really nice integration room for people to integrate after these experiences. We teach people about meditation, breath work, and healthy lifestyle changes, which was what I feel to be the recipe for long-term success with the medicine. So, it's very, it's really what people are going to be comfortable with, but we really try to make sure people are going to be as comfortable as possible here at our facility. And then with what you were talking about with the at-home telehealth protocol, listen, I'm not a fan. That being said, I know that, people need access to different, ways to administer medicine or take medicine or receive it. I just feel that, especially with ketamine being a dissociative anesthetic, this is different from any other kind of psychedelic compound that you're going to be having somebody, do a treatment with, where people get very disassociated, and, people might try to stand up and they don't even realize that they're trying to stand up or something. And I see that this has a high potential for somebody getting injured. And I really feel like you should have somebody there watching after you. Even with some of the protocols I heard with these at-home telehealth companies, where, we want to make sure that you have somebody in the house with you, which also I think could be dangerous, because if somebody's a trained professional, or if they have experience in this realm, it's one thing. But if somebody gets into a disassociated state and starts like moving around and screaming or something like that, and the person isn't trained properly, I think that could be dangerous as well. Or like, hey, listen, if you got a 300-pound guy who's a war veteran that's doing an at-home treatment, and his wife is sitting there sitting him, and all of a sudden he goes into a spin where he's disassociated, and she comes over and starts trying to shake him and say, "Are you okay? Are you okay?" That could be dangerous for her as well. So I think that there's just so many variables of ways for things to go wrong that, like I said, I'm really not a fan.
Yeah. And, the ketamine experience, for me, I prefer to be in the clinic. I mean, I've been really deep on a lot of different things, and ketamine obviously takes you very deep. But yeah, you're pretty much out of it. I mean, it's one of those things where I feel you need someone there in person to kind of at least watch over you and make sure again that you don't get up and do something that you're not aware of, because obviously that can happen. Now, one thing I like about the ketamine experience is that you relax into it. So like at your clinic, when I got my intramuscular injection, for about 5 minutes, I felt like I was kind of like on a Xanax or something, very relaxed and just kind of melting into the seat. And then it kind of just slowly takes you away. So it's not a jarring experience, right? You go really deep, but it's not like baseline bam, it's a slow easing into it. And it's a very comfortable thing, I feel.
Well, I mean, I agree, and I've actually used the Xanax comparison with the
Mhm.
way it feels,
Mhm.
kind of like when the medicine first starts to take
Mhm.
effect. And in my eyes, I feel that like when people talk about bad trips, I feel
Mhm.
like a lot of the time when people are having an experience like that, it's because something triggered them to get scared. And then
Mhm.
their anxiety kicks in,
Yeah.
and it's this snowball effect into this
Mhm.
catastrophic experience where
Yeah.
people are very uncomfortable and not having such a pleasant experience. I
Mhm.
feel that this is why ketamine will probably have a less amount of these kind of
Mhm.
experiences where people, because when I tell people, once you feel the medicine start to take effect, any anxiety that you have going into this is soon going to slowly
Mhm.
start to subside. And
Mhm.
then that's when you go back to your breath, in through the nose, out through the mouth.
Mhm.
Close your eyes and just pretend like you're going to take a nap and relax into it. And
Mhm.
because of the anesthetic properties or this calming property of the medicine, it really allows people to surrender and just let the
Mhm.
medicine do its thing and not fight it.
Mhm. Yeah. Yeah, and so obviously I'm more spiritually oriented, and I know when I came to your clinic earlier this year, I found myself in a mental health kind of situation where I needed help, and needed it fast, and I will say that ketamine provide. I did a series of 6 treatments, but after the first treatment, it was like night and day. And in my view, I had some type of energy attachment or some type of blockage that was preventing me from living to my fullest, right? And I felt like even after, again, the ketamine seemed to vibrate me at such a high frequency that all those blockages or things that were no longer serving me had to go. And I definitely felt like they did. And, beyond that treatment, it was just really deep exploration of my life.
No, I love it. Like I love what you're talking about. And the truth is that I think there's a very, very
Mhm.
spiritual component to
Mhm.
these medicines. I think that's where when you come to a facility like ours and then you're comparing it to the one that's really just Western, it's
Mhm.
like a doctor's office
Mhm.
and things like that. I think that being in a facility with people that can help you integrate a spiritual experience
Mhm.
properly and not be like, hey, that's just a side effect of medicine, which is what I've heard other clinics tell people when they
Mhm.
have these experiences.
Yeah.
That's not probably how you should integrate somebody from
Mhm.
something like that, in my opinion.
Yeah.
I actually don't think it's a side effect of the medicine. I think it's probably what the medicine's meant for. And
Mhm.
and I think that that's why the efficacy of this medicine is so strong. The science is great, and the science is all there, and I'm a huge fan of the
Mhm.
science, but
Mhm.
I've had some incredibly divine experiences on these compounds. And the truth is that if it wasn't for the actual experience, it
Mhm.
wouldn't have made me change my life the way
Yeah.
that I did and got me to the place that
Yeah.
I'm at now.
Yeah. So it's kind of a mix between, yes, there's physiological changes that occur, and I've experienced them, obviously, but it's also too the spiritual side, by actually taking a look at these things that also helps. And, what I tell people all the time is I feel like ketamine is best for severe depression, anxiety, addiction. Like it's really like, when you need immediate relief, ketamine in as little as one treatment can really get you in a much much better spot. Then I feel that like for instance, psilocybin, these other therapies are really good, but for people who are really in a pickle, some people don't have a month, 2 months to really integrate these things to try to get better. Some people literally need it today. And I think ketamine provides that breakthrough. One treatment gets you in a much better spot, and then you can work from there. But some people are so bad that they need that immediate relief. And I feel ketamine can most definitely get it to them.
No, I agree with you completely. Listen, I've had a veteran, for instance, come in and be like, listen, if this doesn't work for me, I'm going to take my own life. And like, he needed relief now.
Mm-hmm.
And I'm like, just trust us, man. Just give us a chance. Let us work with you. And after his first treatment was over, I'm like, so tell me, how was it? And he goes, I turned into a bird and I was flying over the landscape. It was so beautiful. And he goes, and I don't know how to explain it, but everything's connected. The answer is love. And I don't want to kill myself anymore. And like, that was like a light switch that went off after his first session. There's other stories that are just like that one that I could give you. And that's the truth, is like, there's a lot of these other compounds that are fantastic, and I'm a huge fan of all of them. But when you're talking about like instant relief for people that are going through suicidal ideation, ketamine is an amazing tool for that. And, and I have to say, listen, like, in my own personal journey, I used like, pretty much all of the psychedelic compounds to heal myself. The truth is that ketamine did what for my mood and my demeanor, what the other compounds really hadn't accomplished for me.
Yeah.
I had some incredibly spiritual experiences on psilocybin mushrooms and DMT and LSD and other compounds like that. But I also still had peaks and valleys in my mood, and I still had depression I was going through, and I still had anxiety that I was going through. In my eyes, ketamine nipped those ones in the bud, and like, it got me to the place now where like, I don't take psychedelic compounds anymore. It was after my ketamine experiences. And like, listen, I have hundreds of psychedelic experiences under my belt. So I'm not saying, oh, you go through 6 ketamine treatments and you don't need to do psychedelics anymore. And everybody's on their own healing journey. There is no right or wrong answer for what you need to do in your journey. Just stay true to yourself and ask yourself in your heart, is this what I need? Is this what I should be doing? And if your heart says yes, well, then, you should probably follow your heart. But I think that, in my personal opinion, nothing had got me to where I got after I was done with my ketamine treatments.
Yeah. And ketamine as a treatment is kind of exploding in popularity, I would say, probably because of the astounding results that have been accomplished with the ketamine therapy.
It is getting more and more popular. The thing that kind of is just mind blowing to me is like, people are so excited about psilocybin. They're so excited about MDMA going through. They're so excited about all of these other compounds because they're psychedelic, the typical psychedelic compounds that people talk about a lot. And like, everybody's really excited that psychedelic therapy is going to start happening. But what people don't realize is that like, psychedelic therapy is here and now already with an FDA approved medication, and like, I'll tell, in complete honesty, I think ketamine is one of the most profound psychedelic experiences that you can have on this planet. Like an intramuscular shot of ketamine and a breakthrough DMT experience are very relatable in my eyes. Or like a ketamine intramuscular shot and a macro 7-gram dose of mushrooms of psilocybin is very comparable in my eyes like that. So it's like, we already have it here now. You don't have to keep on waiting for these other medicines to go through FDA approval. Ketamine is, the efficacies here, the experiences are here. It's all happening right now.
That's right. Yeah. And I hear people a lot of times, and it's true, like, why should people have to wait through this lengthy FDA approval process when people are literally dying every day, especially veterans, right? But I think a lot of people, you're right, skip over the fact that ketamine is available fairly widely and is highly effective at these things, and yeah, I mean, I guess it's just about getting the word out. But again, I think with these other psychedelics, I think this is more indicative of the larger drug war or Controlled Substances Act scheduling process, right? That here we are, these highly effective medically very safe, I would say, compounds are on Schedule 1. And I want to encourage people to take a look at that and ask, why are these on Schedule 1, versus these other? It's all a scheduling artifice. Fortunately, they got it right with ketamine. And as we see, them getting it right has led to tons of healing, tons of breakthrough experiences, and people being able to live, and also live a happier and healthier life. So ketamine, really, in my eyes, is a good scheduling thing, right? So we can look at the case of ketamine and say, oh, they got it right. Now it's widely available. People are using it, getting relief. We have a better world. Whereas these others that are going through the process now, it's like Schedule 1 prohibited. So many people have more or less needlessly died and been depressed all these years, right? And let's top that with the fact that they've been pushing antidepressants on people for over 30 years on bunk science, which has now officially been proven to be false. And more along those lines, have you seen any, have you had people coming in since the publishing of that article about a month ago, now fed up with antidepressants, saying that, hey, now we know these don't work, let's try ketamine? Have you seen any of those cases yet?
I mean, we have, but like we've been seeing people fed up with these medications for a while now.
Yeah.
The truth is that like I give people this comparison. I
Mhm.
feel that like your typical pharmaceutical medications out there, like your SSRIs or your antidepressants, your benzos, it's like throwing a Band-Aid on an open wound
Mhm.
that loses its cohesiveness. It stops
Mhm.
sticking. I'm stuck taking pills
Mhm.
every day. And like I'm not really getting any relief like I'm looking for.
Mhm.
Where
Yeah.
ketamine and psychedelic compounds is like the opposite of that. It's going in and doing the surgery and getting the
Mhm.
job done. And I think that like I think that ketamine kind of slipped through the cracks because it's not a psychedelic
Mhm.
compound. It's a dissociative anesthetic, and ketamine is Schedule 3, and like
Mhm.
testosterone is Schedule 3.
Mhm. Mhm.
Where when things are Schedule 1, it means that they have no medicinal benefit
Yeah. Yeah.
whatsoever, which we know is a fallacy and it's not to be true. See,
Mhm.
Michael Pollan's film, How to Change Your Mind, really shed
Mhm.
light on this.
Yeah.
And what happened is that they were actually even doing clinical studies with
Yep.
LSD years ago for
Mhm.
alcohol use and things to that effect,
Mhm.
and they were having amazing results with it.
Mhm.
The problem is that the Vietnam War came around, and people were having these profound psychedelic experiences, and they were realizing that we are all connected and that there's a
Mhm.
oneness to everything. And people really didn't want to go off to war and kill one another anymore because it just didn't sit well with them. So Nixon went and scheduled everything as Schedule
Mhm.
1 to say there was no medicinal benefits to this because he wanted people to go to war and fight each other.
Mhm.
And that kind of like went against the storyline with
Mhm.
what psychedelics really bring to light or
Mhm.
promote. So, I think that the truth is that in the near future, people are going to see that these medicines have amazing efficacy when it comes to treating mental health and substance
Mhm.
abuse issues. And, another real quick story, like I had a 20-year-old kid that had died of a fentanyl overdose, and like they brought him back to life, but 4 days later, he was getting treated at the facility. He did his 6 ketamine treatments. He no longer takes fentanyl. He no longer does drugs. He
Mhm.
got a gym membership. He re-enrolled back in college, and
Mhm.
like this is just a daily occurrence when it comes to talking about people working with ketamine therapy.
Mhm.
So like
Mhm.
I actually, listen, we can go mental health, we can go spirituality, but the truth for me is like this medicine is going to help transform humanity to a higher state
Mhm.
of
Yep.
consciousness.
Yeah, absolutely. And are there any kind of contraindications with ketamine? Meaning that are any people necessarily disqualified from engaging in the treatments either because of health conditions or certain medications that they're taking?
So one thing that's great about ketamine is that like, so if people know like ayahuasca or DMT, if you're on SSRIs, it can actually like kill you if you do
Yeah.
that. And so it's really dangerous to take them on those medications and you have to get off of everything. Ketamine is amazing because like you can pretty much be on anything.
Mhm.
The one thing that we really tell people is like if you're on any stimulants like Adderall or things, amphetamine salts and stuff like that, don't take it the treatment day.
Mhm.
If you're on benzodiazepines like
Mhm.
Xanax, don't take it the day of your treatment because it can
Mhm.
actually dull the
Yeah.
experience, but it's
Yeah.
not going to hurt you at all, though.
Mhm.
So the thing is that you can be on a string of medications and start ketamine therapy, and it's going to be okay. We just helped one guy get off 11 different medications through the process of his treatments, and so the thing is that I like, when it comes to safety profile, efficacy, like another contraindicatory thing would be like, if you have super high blood pressure, like that's really one thing that we really look out for. There's some doctors out there that won't treat people with schizophrenia. We're kind of like an open from case to case here. I've actually heard people that have been diagnosed with schizophrenia have amazing results from ketamine therapy. So it's really a case by case thing. But like I said, this is one of the, the safest, least toxic anesthetics on the market.
Yeah. Incredible. Yeah. So, thank you for coming today. I do appreciate it. Like I said, I want to try to get the word out about ketamine because, again, especially on the breakthrough stuff with people who are having severe symptoms. I mean, just speaking from personal experience, I mean, there's nothing quite like it. And again, as little as one treatment can effectuate a complete shift in mood, perspective, overall vitality. And so I just want people to know that this is there, and this is definitely something to look into. And speaking from mine and your both experiences with addiction, absolutely it helps. And I just want people to know that. And and I guess anything you want to end up with, just let us know. Here, go ahead.
Just to chime in on the addiction part too. This isn't just a medicine for people that are actually like suffering from substance abuse issues or inactive addiction. I have friends that have 10, 15 years of sobriety sometimes, and they're coming to the clinic and they're doing treatments and they're like, this is the first time I've really been happy in a decade. It's like, I quit taking the drugs. I'm living by spiritual guidelines. I've worked the steps with my sponsor, like things to this effect, but they were still depressed. They still had anxiety. And I'm like, that was one thing for me in my own personal journey. It's like, I wanted to get sober so badly because my life was a train wreck. But every time I would put like 6 months of sobriety together, I was still depressed. I still had anxiety. All of the underlying issues that I was self-medicating with the drugs and alcohol were still there. So I was so miserable. I'm like, well, if this is the way I'm going to feel for the rest of my life, I'm just going to get high again. But ketamine and psychedelic medicines did the opposite of that for me. And they got to the root issue, and they got to the root cause, and they got my depression and my anxiety and all of these other things under control, where I was like, okay, I don't need to self-medicate anymore. And one last thing that it did for me was psychedelic medicines gave me the ability to love myself enough to actually want to treat myself better and start healing myself. I went into a psychedelic experience on 6 grams of mushrooms years ago, and I went out into the universe and I became one with everything. And I realized that we're all it, and that everything is connected, and that we're all extensions of the divine. So coming back from that experience, I realized that, every time I was taking drugs and alcohol, I was actually, poisoning God or the divine at the end of the day, which didn't really sit very well with me. So, so it really, like, it really gave me the ability to love myself, grab the reins in my own life, start to meditate, do breath work, exercise, eat healthier, and do all of the things that are the real recipe for long-term success.
Yeah. Incredible. Yeah. And I can't suggest enough, your clinic, My Self Wellness there in Naples, Florida. For people, I know for some it might be a hike to come across the country to come and do treatment with you, but I highly suggest to come there or a similar place. Again, a place that kind of mixes the spiritual and medical elements together. It just makes for a good recipe in with the substance, with ketamine. And again, I haven't done a survey of different clinics across the country, but I would imagine that there's some similar to yours. But it strikes such a good balance that really shows up, especially afterwards in the integration and working through making lifestyle changes. I mean, it's just so important to achieve that long term, like you said earlier, the long term health. It's just critical, in my opinion.
No, I appreciate that. Thank you.
Yeah.
And so I wanted to give everybody, if anybody out there is trying to get a hold of us, or if they have any questions, you can go to www.myselfwellness.center. Or you can look us up on Facebook or Instagram at Myself Wellness. You can look me up personally on Facebook at Charles Patti, Patti, or I am Charles_Patti_official on Instagram. And we can try to help you and point you in the right direction, or just answer any questions that you might have.
And I will drop all those links in the description for everybody. So yeah, highly suggested to reach out to Charles. And Charles you can reach out to him for anything, but especially if for ketamine, most definitely, he's kind of like me. I think definitely down to talk to just about anybody. So if you have any follow-up questions specifically about ketamine or therapy, feel free to reach out to Charles. He'll be more than happy to answer them, whatever those might be.
Yeah, no, 100%. Guys, listen, this is my purpose. It's my purpose to be of service to humanity. It's my purpose to help people heal. You know, if it wasn't for these compounds, I wouldn't be on this podcast today with Greg. So
that's right.
You know, this is literally what saved my life. And I know that, you know, we are one. So I'm here for each and every single one of you.
And Charles, we'll bring you back on the podcast, because I do want to do a whole one on your just your personal journey and kind of your viewpoints through this psychedelic renaissance, kind of the different parties and where we're headed, because I think that'll be something good for people to hear, because you have such an informed point of view through your personal experience, then obviously also working in this space. But again, we want to thank you for coming on today, Charles. We will have you back on here, and I'm really looking forward to it. Thank you.
All right, brother. Thank you so much for having me, man. Appreciate you.
Thank you, Charles.
All right.